USMLE style question on Duchenne muscular dystrophy. A 4-year-old boy is brought to the pediatric clinic due to difficulty walking and frequent falls. His parents also note that he has difficulty climbing stairs and has an unusual waddling gait. On examination, the child has calf hypertrophy and Gowers' sign, the need to use his hands to help him stand up from the floor. His serum creatine kinase, CK, levels are markedly elevated. The child has no family history of similar symptoms. Which of the following is the most likely underlying genetic defect in this patient? A. Mutation in the dystrophin gene. B. Mutation in the CFTR gene. C. Mutation in the BIA1 gene. D. Mutation in the LMNA gene. Mutation in the alpha-1 antitrypsin gene. Answer and explanation. Correct answer, A. Mutation in the dystrophin gene. This child has Duchenne muscular dystrophy, DMD, a progressive X-linked genetic disorder caused by mutations in the dystrophin gene on the X chromosome. Dystrophin is a protein that helps maintain the integrity of muscle cells, and its absence or dysfunction leads to muscle degeneration. Pathophysiology. Dystrophin connects the cytoskeleton of muscle fibers to the extracellular matrix, providing structural stability. In Duchenne dystrophy, the absence of dystrophin leads to progressive muscle breakdown, weakness, and eventual loss of muscle function. Gowers' sign and calf hypertrophy are classic findings due to pseudohypertrophy, muscle replacement by fat and connective tissue. Key clinical features of Duchenne muscular dystrophy. Muscle weakness begins in proximal muscles, such as hips and thighs, causing difficulty in walking, running, and climbing stairs. Gowers' sign, the need to use hands to help stand up. Calf hypertrophy, pseudohypertrophy, not functional. Elevated creatine kinase, CK levels. Progressive disease, leading to wheelchair dependence by age 12 and respiratory cardiac failure by early adulthood. Onset, symptoms typically appear between 2 to 5 years of age. Why not the other answers? Mutation in the CFTR gene, incorrect. Cystic fibrosis is a disorder of chloride transport leading to respiratory and digestive symptoms, not muscle weakness. C. Mutation in the BRCA1 gene, incorrect. BRCA1 mutations are associated with an increased risk of breast and ovarian cancer, not muscular dystrophy. D. Mutation in the LMNA gene, incorrect. Lamin AC mutations cause Emery-Dreifuss muscular dystrophy, which presents with joint contractures and heart conduction defects, not calf hypertrophy or Gowers' sign. E. Mutation in the alpha-1 antitrypsin gene, incorrect. Alpha-1 antitrypsin deficiency leads to emphysema and liver disease, not progressive muscle weakness. Key USMLE takeaways for Duchenne muscular dystrophy. Cause: X-linked mutation in the dystrophin gene. Symptoms: progressive muscle weakness, Gowers' sign, calf hypertrophy. Diagnosis: elevated creatine kinase CK and genetic testing. Inheritance: X-linked recessive, management. Symptomatic treatment including physical therapy, steroid therapy to delay progression, and cardiac and respiratory support.